Hi everyone, Kim here, your patient care specialist with your weekly Wednesday tip. We have Nicole who was referred to us to discuss replacing a missing tooth with an implant, and she has some questions for us.
That's correct, Kim. So I saw my general dentist last week, and I have a missing tooth in the back of my mouth that has been there for some time. And I didn't see the importance of replacing the tooth because when I smile, you don't see it in my smile line. And aesthetically, it was pleasing for me. But what I found out is that by not having that tooth there can actually be a domino effect that occurs. And my general dentist recommended an implant for me. So he referred me to go see Dr. Elias and yourself so that you can educate me on why I need to have that tooth replaced with an implant.
Sure. Yes, so when you're missing back teeth, your front teeth end up taking on forces they're not designed to handle, and in time they can be damaged and lost. Also, the bone will continue to resorb, and the adjacent teeth can shift.
Oh, I did not know that. Okay, and so my next question is, I definitely am a little bit of a dental wimp. I do have a lot of anxiety. And so when I hear about the implant, I've been putting it off because of that. So can you educate me on the process and the downtime that will occur?
Yes. So the process is fairly simple. We bring you in, maybe an hour appointment, numb you up real nice, and we just insert the implant into the bone. And then we send you on your way for anywhere from 3 to 6 months to let the implant integrate with the bone, or bone integrate with the implant. Okay. And then we bring you back to restore the implant with a crown, porcelain crown. And your downtime, typically 1 to 2 days, but every patient's a little bit different.
Okay. Yeah, and I actually heard somebody say that having a tooth extracted was worse than having an implant placed. Is that correct?
Yes.
That definitely makes me feel a lot better. So as far as the implant itself, what is it made of? What's the different components?
Sure. I have an oversized model here I can show you.
Okay.
So this represents your bone and gum, and this is the implant.
Okay.
Okay, so this is a titanium metal that represents the root of the tooth.
Okay.
And then that goes into the bone, we let it heal, integrate, and then when it's integrated, we bring you back and we put the crown on.
Oh, great. So that titanium actually acts as like a man-made root?
Yes.
And then as far as the crown goes, will anyone be able to notice a difference inside my mouth?
No.
No?
It'll look like you never were missing the tooth to begin with.
Oh, wonderful. And as far as how it works, am I going to be able to chew the same? And are the functions going to be the same?
Yes.
No limitations?
No limitations.
Wonderful.
Your chewing force will probably even be better with an implant.
Oh, really? Oh, that's great to hear. Well, I definitely feel great about all the answers that you've given me. I have a peace of mind about why I should get an implant done, and it looks like I'm going to be scheduling an appointment for an implant with Dr. Elias.
Perfect. We'll get you on the books soon.
Thank you.
Thank you for joining us this week. Please give us a call for a courtesy consultation. Just make sure you say Kim sent you, and we'll see you soon.